everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'm going to be talking about my main video, which is on teamwork. Now, firstly, let's talk about what is teamwork. Well, teamwork is team and work. So if you put those two words together, team and work, it's the team working together. Now, each component in that word is crucial. So without the team, there will be just work. Now, who wants that? And if there's only the team, then that's just the team doing nothing. So each component is important. Now, let's talk about the importance of teamwork both in healthcare and in our daily lives. Now, let's say, for example, at school, I'm having a school project on making a fashion design, on being a fashion designer, and I need to design an outfit for a traditional outfit for any country, like a kimono for Japan, the ao dai for Vietnam, and things like that. And I need to make the kimono for Japan. So that is the traditional outfit of Japan. And I am having a school project there, designing the kimono, and my team needs to work together to deliver that project. Now, the project is due on Tuesday the next week, and I'm currently on Saturday in this week, and now the project is due on Tuesday. So what am I going to do? Well, of course, I need to have some communication with my team members so that we can delegate the task. Who is going to buy the doll for the actual kimono, who is going to sew the kimono, and who is going to draw the design for the kimono. So that is one example of teamwork in our daily lives. Now, what is the importance of teamwork in healthcare? Well, firstly, personal and professional growth. Next is a boosted morale. So if we have teamwork, we will have more motivation to work, and therefore it will lead to more productivity and less stress. If everyone has a task to do, the task will be delegated evenly, and the team leader won't be stressed out or anyone will be stressed out with a lot of tasks on their back. So those are the four importances. Next is innovation and creativity. Now, within the team, if anyone is doing badly currently, they will have more feedback. They will have feedback from their patients, from their peers and their leaders, and that will lead to more innovation. They will improve their performance, and there will be more creativity within the team. Next is a better communication, and better communication will lead to better results, which will lead to decreased medical errors. So those are the importances of teamwork in healthcare. In our daily lives, teamwork is important for delivering everyday tasks within the school project, like I've said before, in the school project, or in just the office, and even in our home. For example, in my household, everyone has a task to do. One needs to clean the house, one needs to do the dishes, one needs to load the laundry, one needs to fold the clothes. So each individual member of the family needs to delegate each task to everyone, so that we don't have to have one work on mom. So that is the importance, and two examples actually of teamwork. Another example of teamwork in healthcare is surgeons, nurses, and anesthesiologists working together in a surgery, and if they work together in a surgery, they will have more productivity, and that will lead to that will prevent medical errors that might arise. If there's some conflict within the nurses, the surgeons, or the anesthesiologists, then they won't be able to work together harmony. So they won't be able to work together, they won't get well with each other, and then there will be conflict within the team, and that will increase the chance of medical errors. Next, I want to talk about the ways to improve teamwork. So firstly, we must have clear and concise, respectful communication. When talking to the patient or other healthcare professionals, we must have clear and respectful communication. Next is we need to clarify the roles. Each individual member has to have a role and responsibility within the team. Next is establishing team rules. Now, the team leader must establish several team rules, like when we send in the work before after the deadline, or when we have conflict with each other, with the other members within the team. What will we do? What will we need to do? And what we are required to do. Next is don't complain. When we complain, that will lead to more conflict, and more conflict will lead to more stress and less productivity. So next is recognizing the team efforts, even if it's a small achievement. The team member must reward the team with a little saying of good job team, you're doing well, like that, or give some feedback on how the members are doing lately, like is anyone doing good, bad, anything. Build trust using all of these things above, establishing clear goals, and active listening. Now, there are three skills that work together in the medical field. One is teamwork, two is communication skills, and three is empathy. They work together to give out a certain goal of making the patient's experience good. So yeah, that is the three main skills that will work together in the healthcare and medicine field. The last part is how to communicate effectively with other healthcare workers and patients. Now, in this part, you might recognize some of the things that I've said earlier in the second part, and these two parts also have some similarities. Firstly, for healthcare workers, other healthcare workers who is working on a certain patient, we need to use language, clear and concise language, so that everyone knows what is their role, what is their responsibility. Next is respect. We need to respect the healthcare workers, their role, and not underestimate them or make them feel intimidated. Next is active listening, like I said before. Acknowledge different perspectives. Everyone has their own perspective, their view, and their own opinion of a certain thing. So we must acknowledge the perspectives that they show up, and also their opinions, so that we can prevent the conflicts from happening. Next is empathy, and be professional. So maintain your professionalism. Next is for the patient. We must use plain language. Don't use I won't use as a doctor. I won't use any advanced words that the patient don't know, because then the patient don't know what they're going through, what are the symptoms, and what treatment plans are presented to them, and then that will lead to more questions and more misunderstanding within that. Open-ended questions. I will need to ask more open-ended questions, not closed questions like yes or no questions or one-answer questions. The next thing is consider cultural and linguistic differences. Like I said before, everyone has their own backgrounds. One is from Africa, one is from Asia, one is from Europe. And of course, for each different culture, we have different languages, and they have different beliefs. So we must know how to communicate effectively with the different cultures, because they have their own beliefs on how this person must behave. So shared decision making. When making decisions with the patients on their treatments, we must explain the treatment plans, all of the treatment options to the patient so that they will know what they will need to, what treatment will they need to go through, and then make the decision. Encourage some more questions if they are wondering something, and be professional. Like I said before, maintain your professionalism. So yeah, those are all the things I have to say for this video. But before we go, I want to add in one more quote. A boat doesn't go forward if each one is rowing their own way. If a boat, so let's take for example, the boat, and there are 4 people on the boat. One person is rowing this way, one is rowing that way. So the upward direction and the downward direction. And so the boat isn't really going anywhere. And yeah, that's exactly what this quote is saying. A boat doesn't go forward if each one is rowing their own way. So we must clarify your goals, your responsibility, and we must have the same shared goals so that we can move forward onto the road of success. And this quote is from a Swahili proverb. So it's a Swahili saying. And yeah, those are the things I have to say for my video this week. I hope that you learned something new from this video or just review some of the things that you have learned. Thank you again and goodbye. See you later.